Hey guys, welcome back. And today we are going to discuss about crisis management in nursing and nursing education. So first we will see what is crisis. Crisis is a situation where something or someone is impacted by one or more significant problem. A situation where something or someone is impacted. If you are in trouble, if you are in serious trouble, okay, and that situation is known as crisis. Crisis management is a process that you or your organization use to identify, prepare for, respond to, and recover from critical events. So you are taking a solution, you are implementing the solution, okay, and you're preparing yours and you're recovering from the specific situation is known as crisis management. And what is the goal of crisis management? The goal of crisis management is to minimize the damage and protect people and property while restoring normal operations as quickly. I'll repeat. Crisis is a situation where something or someone is impacted. You or your family is impacted by a situation or by something, okay, by one or more significant problem. A situation where something or someone is impacted by one or more situation or problem. That is called crisis. COVID. It's a simple, easy, okay, example for crisis. That is a natural crisis or that is a natural disaster. Okay, so disaster is a crisis. Okay, so that crisis or situation affected us in a very bad way, right? So that is crisis. So crisis management is the process that you or your organization use to identify, prepare for, or respond to the and recover from the critical events. The goal of crisis management is to minimize the damage and protect people and property while restoring the normal operations as quickly as possible. So now we will discuss what is crisis management in detail. So crisis management means, or what is crisis management? Some skills, strategies and actions you have taken to handle the high stress which is developed or arised from stress. Okay. For example, sudden health deterioration or pandemic, natural disasters. These are all examples for crisis. What kind of proactive measures you have taken to prevent that potential crisis? That is called crisis management. What is the relevance or significance of crisis management? It can improve the patient outcomes, it can enhance the operational efficiency, and also it can build confidence among healthcare staff also in your patients. We will take COVID-19 as an example. Okay, the COVID-19 pandemic presented unprecedented challenges to global healthcare system. Okay, what type of crisis management, okay, they have taken? They, in the sense, the hospital or the health department, okay, were taken or were enacted to handle the issues, okay, such as resource scarcity, patient overflow, and rapidly changing information. So these are all the problems they are faced, or otherwise we can say we have faced. Resource scarcity were there, patient overflow were there, and rapidly changing information. These are all the problems we have faced during that time. So in terms of overflow of management, what type of crisis managements we have taken means expanded healthcare facilities to manage surge in patients, including creating temporary field hospitals, utilized telemedicine to reduce in-person visits and prioritize critical cases. Then, in terms of resource scarcity, what type of crisis managements we have taken means developed efficient system for the allocation of limited resources, including ventilators, ICU beds, and oxygen supplies, and also adopted guidelines for equitable distribution or equal distribution based on the patient needs. And in terms of evolving information management, or in terms of evolving information, what type of crisis managements we have taken means we, in the sense, we nurses or doctors or healthcare department or our healthcare system established rapid communication channels for sharing updates on virus spread, new variants, and treatment protocols. Integrated evidence-based decision making in care approach as new research emerged. I think you have an idea now what is crisis management. So in crisis management, we will take some specific strategies. We will take some proper strategies, or we will develop some strategies. We will develop some plans, okay? And we will implement the plan to overcome the situation. Then some more examples for crisis management. Okay, sourcing personal protective equipment for preparedness through foresight. Okay, implemented strategies to acquire and stockpile PPE, including local production and international collaboration. Then distributed PPE efficiently to healthcare workers in high-risk zones. Also, develop some new protocols as a part of crisis management, which include develop specialized care guidelines for COVID-19 patients, include safe handling, isolation, and discharge procedures. Then also updated infection control practices to minimize healthcare workers. So these are all the examples for strategy-based, okay, need-based, or based on the demand-based crisis management techniques. Or so you have to follow these type of crisis management strategies if you face any kind of crisis or any type of crisis at your workplace. Okay, as a nurse or as a healthcare worker, it's your, or as a team leader, or if you're responsible to control a team, it's your responsibility to manage the crisis also. So you have to follow these type of crisis management modalities in a systematic way, organized way. Then only you can manage the situation. Then only you can develop confidence among your team. Then only you can provide enhanced care to your patient. Then only you can improve the patient recovery. So, in conclusion, we can say what type of techniques you have to possess or you have to hold in your hand if you are a leader to manage crisis. You have to identify the potential crisis. You have to design the communication system, and you have to define the roles and responsibilities and schedule training and reviews. Okay, for that you can provide leadership to the people during disasters, and you have to address the globalization and societal challenges in increasing emergency risk, and also control chavos for efficient and effective care delivery. What kind of skills you have to possess or you have to develop to do all these things? You have to develop effective communication, like clear, concise, factual communication. You have to develop reliable leadership qualities like calm, empathetic, systematic, approachable leadership qualities. You have to develop critical thinking, like analyze, evaluate, synthesize the information rather than taking a sudden decision. Then you have to develop the plan, you have to activate the plan and implement the actions. For that, you need active listening, okay, situational assessment, and patient engagement capacity. You need active listening, you need situational assessment ability, and also you need patient engagement. That means you need to understand the patient situation, you have to observe and analyze the context, and also you have to provide support and reassurance to the patient. Now we will see 5 C's of crisis management. In communication or in crisis communication, you have to follow these 5 C's, or you have to focus on these 5 C's: comprehension, clarity, consistency, credibility, and contingency. Comprehension, clarity, consistency, credibility, and contingency. In terms of crisis or in times of crisis, it is crucial to understand the situation thoroughly. That is called comprehension. And you have to communicate clearly without causing confusion. That is called clarity. And also you have to ensure all messaging remains consistent. That is called consistency. And also you have to show credibility. That means ensure that the information is accurate, verified, and trustworthy. And at last, you have to be adaptable. You need to be adaptable, and you have to possess flexibility in communication strategies and ready for evolving situation. And together, these principles helps organization and you to maintain trust and navigate crisis with confidence. Now we can see a study related to crisis management. NACE manages coping strategies for crisis management. Findings from Philomena et al.'s 2024 study, and they have used systematic review to analyze the strategies used by nurses management and the methods they have used, interviews, questionnaires, and focus group, and they have identified good communication, organizational commitment, and emotional supports among nurses. And one recommendation they have given from the study, okay, from their research, that is institution, that means a hospital or the workplace should support nurse managers in stress management and adaptation, because they are undergoing a lot of stress while doing this crisis management process, or while developing the strategies, while coordinating the strategies, while collaborating them with other teams, etc. Then also, it is very important to study what is disaster. So studying disaster in nursing education is also very important. Otherwise, you cannot understand what is the crisis, what is the root cause of the crisis, what is the type of crisis. Either it is a natural crisis or it is a man-made crisis. So, what is disaster? You have to understand that first. Disaster means a serious disruption exceeding communities' coping capacity. There are two types of disasters, like natural disasters and man-made disasters. Natural disasters, COVID is a natural disaster. Okay, hurricane, that's a natural disaster. Volcanic eruption, tsunami, all these are natural disasters. When it comes to man-made, terrorism, okay, bomb explosions, bomb blast, chemical explosions, cyber attacks, these are all man-made disasters. So these all kind of disasters can develop what? Crisis. So you to develop the proper plans for the crisis, what you need to know, you should know what is disaster, right? So as a nurse, or nurses should learn what is disaster, or we have to include nurses disaster education in nursing curriculum, because nurses are vital responders in disasters, and need for disaster readiness is increasing due to global threats, and disaster education will enhance the preparedness and responses capabilities. Basically, there are four phases for disaster management cycle. First one is mitigation, second one is preparedness, third one is response, and fourth one is recovery. And nurses need to go through all these stages. Nurses need to participate actively in all these stages. So to participate in all these stages, they should know what is disaster first, right? So if you're thinking about the historical context, you know who is Florence Nightingale. She is known as the founder of modern nursing. Nightingale's work during the Crimean War highlighted the importance of organized care in crisis situation. Organized care, that point is very, very important. So to provide organized care, you should understand what type of disaster it is. War, what type of disaster? It is a man-made disaster. It's not natural disaster. So she introduced hygiene practices, statistical tracking, and efficient patient care methods. These are all the crisis management measures she has taken. Okay, statistical tracking, efficient patient care methods, reducing mortality rates significantly. Her methods were not only groundbreaking but also foundational for modern disaster response. So now we are studying modern disaster, but what is the basis of that modern disaster study means? This is the basis of that modern disaster study. Then also, when it comes to Clara Barton, she is the founder of American Red Cross, and Barton is celebrated for her humanitarian work during American Civil War. Okay, that's a man-made disaster. She provided aid to soldiers on battlefield and helped communities to recover after disasters. Her legacy emphasized the importance of compassion, preparation, and coordination. Again, the same thing we can see here: organized care, or compassion, preparation, and coordination in disaster. A coordination we need. So to develop a coordinated or organized disaster management techniques, you have to know, you should know, you must know what is disaster, what is crisis, right? Yes. Then there are some gaps in current education according to the studies. Despite its importance, disaster education in nursing program remains inconsistent. Most curricula focus heavily on the response phase with limited attention to the mitigation and recovery. Guys, that's what I said. There are four stages. Nurses need to actively participate through all these cycles. But the study is saying that most of the curricula focuses heavily on the response phase with limited attention to mitigation and recovery. This fragmented approach leaves nurses feeling unprepared for large-scale disasters, as reported in several studies. Addressing these gaps through a standardized curriculum is essential to ensure comprehensive disaster readiness. Then, now we'll see the future of disaster education. The study says that to bridge the gap, okay, disaster education must become a mandatory and integral part of nursing program, beginning with foundational courses in undergraduate studies and continuing with advanced training throughout the nurse's career. This approach ensures continuous learning and preparedness. It approach ensures continuous learning and preparedness. Well-trained nurses will respond to the disasters with confidence, protecting themselves and their patients and their communities. To protect themselves, to gain confidence, to protect their patient, to protect the staff, to protect the community, we need training. So the future must be like that. Okay, need to be like that. You have to learn everything from, you have to learn all the stages of disaster management cycle rather than just sticking on the what response phase. So this is about crisis management and disaster. Okay, so disaster can lead to crisis. If there is a crisis, you have to develop proactive measures to overcome the crisis. To develop the proactive measures, you need to know what is crisis. You need to understand the root causes of the crisis. That means what type of disaster leads to this crisis. Okay, so we have to so the researchers, many researchers are saying that we have to include proper disaster management education in the curriculum. So hope you understand, guys, what is disaster, what is crisis, what is the management, what is crisis management, what is the role of nurses in crisis management, and what kind of techniques and skills you have to possess to manage crisis. Thank you, guys. So next time with another video. Thank you.